Our next panelist is someone who is also another statewide expert on the challenges of youth homelessness, someone who has been working for over a quarter century to change the lives of young people in San Diego since he started first working on the streets of Southeast San Diego with gang kids in the mid-1980s. Walter Phillips today is the CEO of San Diego Youth Services, which services over 13,000 homeless, abused, and at-risk youth annually. And since its inception some 45 years ago as the third shelter for homeless and runaway youth in the country, his organization has stabilized the lives of over 500,000 young people and their families. I want to welcome you to this panel. And I want to ask you a question that I wanted to also ask the last panelists and hope that both of you can touch on this. There are three specific populations that I have a particular interest in. One is around LGBT youth, who we know in the state of California, we have 40% of our country's LGBT young people who are homeless. Second, love if either of you have thoughts specifically around victims or survivors of trafficking. This year in our legislature, I understand there are probably over 36 bills that address the topic of trafficking victims and survivors. I'm wondering if you could talk about the housing and homeless challenges that they might face. And the third category, and I know our previous speaker touched on this, the challenges specifically facing unaccompanied minors, undocumented kids, many of whom we know are coming as refugees, fleeing violence and repression from Central American countries. If you could just give us a little bit of a sense of, are there particular models or programs that are helping any of these three specific cohorts, and are there more things that the state can do in those areas? But I know you, Mr. Phillips, have a more general presentation, so I don't want to keep you from that.
Sure, thank you. And I first want to say thank this body for actually carving out some time on the issue around homelessness to focus on youth. I think oftentimes youth get shortchanged. I'm going to talk a little bit about what's happened in San Diego, and oftentimes youth get left out of the conversation. And those youth aren't here to speak for themselves, so Amy and I are here to be able to speak for them. I'm actually very happy to be able to sit up here with Amy and follow her presentation, because I think it really transitions very well into what I'm going to talk about. And Amy touched upon the issue of those youth who otherwise have been abused, who have been neglected and should be in the foster care system, are not. And I think that's something that has been neglected for far too long. Also, just in terms of what our organization does, we serve at-risk youth, and as Chu said, over 13,000 youth a year. We actually have services for both kids who are in the system, foster youth, and kids in the juvenile justice system, and then services for non-system youth. And so in my first slide, I just have a quick definition of what we consider homeless youth. I won't read that. But I really want to focus on is what are non-system youth. And these are youth who have never been a part of either the foster care or juvenile justice system. And one of the earlier speakers talked about no wrong door policy. For non-system youth, there isn't a right door. They didn't get in the door of foster care, so they do not have the benefits of AB 12. They do not have the benefits of THB Plus, but are exactly the same youth. I have a foster youth. He's now in his 30s, but he went through that system, and he didn't have advantage because those systems were not in place yet, and he struggled through his transitional years. So I think that's something that's very important, that the system that was designed to help these youth, they're not able to access those support systems because they didn't get in the right door. Some of the reasons for homelessness, and I'm glad you talked about the LGBT issue, and that's something that I won't go over all of the reasons, but there are many multiple reasons. As Amy said, youth do not want to be in the streets because it's better for them. The situation at home must have been so horrible, or such a traumatic situation, that they preferred going to a life of uncertainty on the streets or to what else might be out there than being in their own home. And we saw that when we've opened our runaway and homeless shelter over 45 years ago, that there are youth that are fleeing situations at home because it's safer for them on the streets, if you can imagine that. In terms of the LGBTQ issue, they are very much overrepresented in the homeless population. They represent about 5 to 10% of the population of youth. They actually represent roughly 15 to 25% of the homeless youth on the streets. In San Francisco, it's actually larger. It's about 40% of the youth on the streets are LGBTQ. So it's a particular issue that is faced with LGBTQ youth, often because of what their families are unable to accept the fact that they have expressed their preference. In terms of consequences of homelessness, and we talked about it in terms of what happens to a young person when they're on the street. And Father Joe Carroll, who you may know in San Diego, who's a homeless advocate, has built incredible systems for adults and some for youth in system. We partner a lot with him in his organization. And one of the quotes he said to me, and I never forget it, is that we are in competition with the pimps, the gang members, the drug dealers for these young people. If we don't get these youth within 72 hours on the streets, they're at high risk for getting involved and being victimized. So we need to deal with them. 60% of the young people who are involved in commercial sexual exploitation, and that's been a lot of resources and energy have gone into that at the state level and locally. But 60% of those are youth who are homeless and become victimized. So that is another reason why we have homeless youth. And it's something that, again, I think we're starting to address that issue. In answer to your question, I believe that some of the shortfalls, at least in San Diego, are not enough, housing, not enough coordination, and also the fact that it's very difficult to get these young girls off the streets and away from that life that they've been trapped into. But if we can take that into questions, I can answer that.
If I could just for 10 seconds, I guess what I'm wondering about is obviously all of these young people are not the same, and the question is, should our policy responses be very specific to their situation, or are there sort of broader policy responses that you think are able to address most of the issues that we're talking about?
Well, I think as a starting place, and I'll talk about it, is we need to have a policy around homeless youth that are non-system youth. We don't have anything in this state around that. And when I talk about the resources that this state provides a little bit later, we can talk more about that. So as a starting point, we do need just a general policy issue. We can have subcategories as we deal with those specific issues around, safe housing, for example, that you would have to have for a CSEC victim in terms that might be a little bit more unique than another youth. But I would say let's start with getting just the youth issue and youth who are not in the system. We have incredible policies and we've had resources, not enough, as Amy has said, for kids who are in the foster care system. We do not have those for youth that have not been in the system. In San Diego, just to bring it home to San Diego, here are some statistics. And one of the things I wanted to point out is that in the point-in-time count that we just had in 2015, 57% of the youth that were counted on the streets were non-system youth. So that says something about the fact that we have non-system youth that are out there. They're oftentimes facing the same issues that foster youth have, but with less resources. In San Diego, one of the things that our county did with the Mental Health Service Act dollars and through some innovation funding, as they funded a unique program where we, in partnership with several other nonprofits in San Diego, developed these transitioning youth drop-in centers there are 5 throughout our county that were targeting homeless and at-risk homeless youth. Through those centers that we had, and they were for both foster youth and for non-system youth. In fact, one of the things that the county asked us to do was really expand those services for foster youth. Out of the 1,000 youth that we serve annually through that system, 66% of those youth are non-system youth that are coming through those doors. Those are 18 to 24-year-olds. So again, this is the picture in San Diego. And again, the counts, you look at the point-in-time count, they don't really accurately reflect, youth in terms of who's really on the streets, who really is homeless, because homeless youth aren't out there saying, hey, count me. So we estimate around 2,000 to 3,000 through our outreach efforts and collaboration with others in San Diego. What are some of the resources? I think I was asked to come here from San Diego because we're perceived as being rich in the work we're doing around homeless youth and the resources that we have. Which actually is ironic because although we have done some good work in San Diego, we're really, I think, have not addressed some of the issues that other counties, other cities have addressed. And I've been around the country visiting some of those cities. Also, the number of resources in San Diego, although it looks like we have much more in San Diego than we do in other parts of the state, they're still very, very, very underfunded. The state, through the Homeless Youth and Exploitation Program, provides about $180,000 to our organization. We're one of 4 organizations in the state that's funded for homeless youth services, and I'll talk about that program specifically in a later slide. We have a total of 17 beds in San Diego, shelter beds for homeless youth. That's it. That's primarily funded by federal, and those HYEP dollars, the Homeless Youth and Exploitation Program dollars, helps us fund that. It helps us provide shelter funding, helps us provide outreach, helps us provide case management, helps us provide mental health services. So it helps leverage some of the other funds that we have to do that. There are no dedicated beds in San Diego for transition age youth 18 to 24. None for shelter. And those young people don't go into the adult shelters. They don't feel comfortable with the chronic homeless population, and they're not eligible for the shelter that we have the 17 beds for under 18-year-olds. On the transitional housing placement program that Amy talked about, we have about 230 TAY beds funded by the state. We have 60 beds for non-system youth in San Diego, and that's primarily funded through some federal dollars and private funding. So that's kind of the what it looks like in San Diego in terms of homeless youth. What are we doing? What are some of the planning efforts? Through the National Association for the Education of Homeless Children and Youth, we got some funding to start to put together a homeless youth task force. So that group is meeting on a monthly basis, looking at coordinating services, what resources are out there, what are some of the policy issues. Not a lot has been accomplished yet in that task force, but there is some focus now being generated. The Regional Continuum of Care Council was a response from our county to what's happening with HUD, asking for a continuum of cares to coordinate services around homelessness. Very little attention is paid to youth in this council. There is a youth representative on the governance body. There are plans for a youth subcommittee, but there really hasn't been that much done around youth. The focus really has been, and rightfully so, in our community, veterans and chronic homeless population. The Regional Task Force for the Homeless is really, they do data collection. They do a little bit in terms of youth. And then there was a 5-year work plan toward ending homelessness in downtown San Diego. It's a 5-year plan. It's a 166-page report. A third of a page is given to youth. So I want to just call that out as we think about how do we move forward in terms of policy at the state level around addressing youth. We have to give it more than just lip service. We really have to make an honest effort and not just give a third of a page to a 166-page report. We have to take the bull by the horns and say youth are a priority and we need to make a difference with them. I gave this story, and I'm not going to read Lakeisha's story, but it's the face of homelessness. What happens to a young girl who, because she was being raped at home, ends up on the streets, gets seduced by a young man who says he's going to be her boyfriend and take care of her, ends up being sexually exploited and forced into prostitution, ends up on the streets again after being pregnant. And fortunately, she ended up in our shelter. We were able to, through our street outreach team, to get her into our shelter. Because she was in the system, the resources were very limited in what we could do. We had very limited beds for her beyond the shelter. Fortunately, we had an opening in the few beds that we have where we have a waiting list for our transition age youth or non-system youth. We were able to get her in. She's now doing well. She's a lot of ups and downs. It wasn't something that she came in and before you know it, she was a model resident and young person with us. It took us a long time. But I just wanted to let you know. And, here's something. This is a real person. In fact, I had a call about 3 weeks ago from Speaker Tony Atkins, and she called and she said, Walter, I need your help. I have a 22-year-old young man I found on the streets doing the point in time count. He's never been in the system. He ran away from his home after being raped by his older brother for years. There's not anything that I can do. I don't have any place to put him. So she contacted me, and we were able to work something out, but he didn't have some of the resources that are available. We see these kids every day, every week. Always happens on a Friday afternoon about 4:30 when these youth walk into the office. I don't have any place to stay. I'm homeless. I've been victimized. What's happening in California, just on a big picture from San Diego to California, only a third of the counties in California actually have services for non-system homeless youth. The shelter beds for homeless youth in California, primarily funded through the federal government, have actually gone down since 1990, and that's while the population of homeless youth have gone up. And the state funding that we currently have, the Homeless Youth and Exploitation Program, which I want to spend a little bit of time on, provides $1.1 million to fund 4 programs in the state. The other 50 so counties don't have any funding from the state. So, and we're fortunate in San Diego, we are one of those funded programs. That funding has not changed since its creation in 1988. So the 4 counties, San Francisco, Los Angeles, Santa Clara, and San Diego County, are providing those services. And they're administered right now through the Office of Emergency Services because it originally came out of the Office of Criminal Justice Planning. One of the things that we are hoping to do, and it's actually through another Assembly Budget Committee, Subcommittee 5, is we're going to be asking to increase those $1 million. When I was talking with some people in the back and listening to some of the presentation, we're asking to increase that to $25 million so we can try to get these services to other parts of the county. I'm thinking, in LA County, they're talking about $300 million, $173 million just to address homelessness in their county. And when I was saying we're asking for $25 million, I thought, boy, that's nothing. It's nothing. And these are to get kids off the streets, to transition them into safety, transition them into stability, giving them the life skills that they need, providing the mental health service and the case management so that they can become successful and independent. And our goal really is to get them into a place where they will not need services in the future. And I think that's one of the things that's really important, and I do want to leave you with that, is that if we are serious about homelessness and we're serious about preventing homelessness, one of the best investments we can make as a state is through our service, providing some investment into our young population. If we can do that, if we want to be a leader as California is leading it, we have a choice. We can invest in young people. They can become model citizens. They can become independent. They can learn those skills to be self-sufficient. Or we can choose not to invest in them, which increases their high risk for being chronically homeless, being incarcerated, and from causing us more dollars in the long run with those systems that they end up in. So just some stats in terms of where we are in California. We do have a very high population. We have over a quarter of the country's homeless youth are in California. And in terms of sheltering youth, because we only get about 11% of the funding from the federal government for sheltering homeless youth, we're second worst in the country in sheltering homeless youth that are not in the system. So with that, I'll leave it some questions.
I guess I would just say thank you for driving the point home, both of you, because, I knew it was bad. I think the statistics that you gave illustrate how bad that for youth who are not in any system, that there could be 17 beds in one city. And imagine that the other cities in our state. I've had that experience of meeting a young person who had nowhere to go, and he also didn't fit into any of the existing systems. And there was one shelter that I knew of, and that shelter has, I think, 8 beds. And so clearly, I think you both just have driven home the point that we need to invest in our youth, an expansion of funding for youth who are in foster care and probation through the Transitional Housing Placement Program, and an expansion for youth who don't fall into any system so they can have a right door to go through. That 555 beds is not enough beds for the youth of California. So thank you for really putting emphasis on those points. Last year, I'm very proud of what we did in Sub-1 last year. We asked for over $20 million to expand THP Plus funding and to make that available to foster youth and to homeless youth who didn't fit into foster or probation programs. I don't want to say what we're going to do this year. Just suffice it to say we hear you and thank you for making the point and the emphasis. Thank you. Other questions or comments for these panelists?
Thank you very much.
Thank you both.
Actually, one final question. One of, I think, the most helpful set of statistics in this area is for you to tell us, if we don't invest today, what will our costs be in the long run? And I don't know if you have numbers off the top of your head, but if you don't, love to see them, because we all intuitively know for every dollar we don't invest today, it's 5-fold, 10-fold, 5 years, 10 years down the line. But it's hard for government, I think, to focus beyond the short term. So if you have any quick thoughts on that.
Just, I don't know the big picture numbers, but I know in San Diego we looked at these numbers for providing shelter and transitional services, getting kids the skills and the support service they need. It would cost us about $20,000 a year to do that, to get a kid to be self-sufficient. If that young person ends up in our juvenile justice system in San Diego, it's about $75,000 a year. So you can see just that example, and I'm sure there's people that crunch numbers better, but in terms of what are some of the other costs that they face.
I can share with you the cost-benefit analysis that was done when the policy to extend foster care was being deliberated. Mark Courtney, who's a leading researcher on transition-age youth in the United States, looked at the outcomes and looked at the investment, and it was for every dollar invested, it was a $4.26 return. So quite precise. And if you could get that kind of return in the stock market, would you even think twice about putting your money there? I mean, that is huge. And so I can share that report with you. But we know these young people do not go away. They just move from system to system to system, and it gets more and more expensive. So putting our money here at this time can really forever change their trajectory.
Thank you.
Thank you so much again. The next panel is going to be on the state's role in homelessness, and with us is Cindy Kavanaugh. Cindy serves as the Assistant Deputy Director of Homeless and Housing Policy at the California Department of Housing and Community Development, where she has served as coordinator of the Policy Academy to reduce chronic homelessness since 2012. Thank you so much for joining us. And
we're also joined by Todd Bland, who is the Deputy Director of the Welfare to Work Division at the Department of Social Services, and he's got ongoing oversight of major public assistance programs related to CalWorks, CalFresh, emergency food assistance, and many other, as we are glad to have you both here. We look forward to what you can share with us this afternoon.
Thank you so much. Good afternoon. I appreciate the opportunity to share some information on the Department of Housing and Community Development programs and efforts that are intended to address homelessness. And I'll highlight two existing HCD programs. The Multifamily Housing Program, Supportive Housing, finances supportive housing, capital costs, and received significant funding through two bond measures, Prop 46 and 1C, and most recently in 2014 through general fund support. The Emergency Solutions Grant Program supports local homelessness response activities, including rapid rehousing, outreach, and engagement to persons living in unsheltered locations, and shelter operations, including the services that go along. Now, HCD administers about $11 million in annual federal funds on behalf of the areas of the state that don't receive ESG directly, but it is a model that you might want to look at for additional investment. First, I'd like to share some lessons learned from the Policy Academy to reduce chronic homelessness that was supported by the Substance Abuse and Mental Health Services Act agency in 2013. And there we pulled together about 50 stakeholders, hearing much of what you heard today, and over the course of the year looked at the most impactful investments and opportunities for the state to address chronic homelessness specifically. And so real briefly, we've heard many of the themes, but I wanted to highlight some and maybe some that are a little different. We see a shifting in local systems, not only to housing first, but in a systems approach in the homelessness response. And I think that's important to support systems and to understand through data and through the coordination that involves how the state interventions and other interventions are working. Rapid rehousing is obviously a key intervention, and I just want to mention that not only does it assist the individual to exit homelessness quickly, but it actually increases shelter capacity by increasing the turnover within the shelters. We've heard a lot about supportive housing, housing first, and the Policy Academy spent a fair amount of time looking at the intersection of housing and health. in supportive housing and the potential to deliver health services flexibly for residents through the 1115 Medicaid waiver and the health homes option. Both of these are currently being implemented, underscoring the need for ongoing and deep health and housing collaboration at both the local and state level. The implications of the lessons learned for any state program addressing homelessness include the following. Focus on the core interventions that end homelessness, rapid rehousing, and permanent supportive housing. Funded interventions should impact key performance objectives at the provider and system level. Homelessness should be brief. That is, we should measure how long. It should be rare. We should measure how many become homeless, both one time and over the course of the year. And it should be one time, and we should measure who returns to homelessness in conjunction with the funded interventions. We should target interventions appropriately, and certainly subpopulation programs are appropriate, but we should have funding for we should be flexible and be able to serve all populations that present locally so that we can, with those flexible approaches, accommodate the highest local need and local conditions. We should incentivize or require best practices in implementing whatever the other intervention. They should be client-centered approaches, culturally competent, housing first, and low barrier, targeting resources through coordinated entry, using local coordinated entry, and other evidence-based practices. Just on the point of lowering barriers to housing and other interventions, we should make sure that the housing that we finance through the state, whether it's supportive housing or just general, is accessible to families and individuals experiencing homelessness. We should support and strengthen these local systems, and capacity building was mentioned. But we also recognize that no one system can solve homelessness, and you've heard that over and over today. So investment must partner with other systems of care. This may mean incentivizing partnerships with public housing authorities, as you heard earlier, for project-based vouchers, or with local employment, education, and health systems for ongoing services. The CalWorks Housing Support Program, which you will hear more about, is an excellent demonstration of expanding solutions to homelessness across systems, braiding crisis response with mainstream income support, education, and employment services. So on those two programs I mentioned, MHPSH, there are several state programs that support, focus on increasing supportive housing, but one of the most flexible and effective housing production programs is MHPSH. With intermittent but significant funding, this program has invested about $475 million since 2003 in 125 developments with a total of 6,600 units and over 3,600 supportive housing units. It has deep affordability with over 70% of the rents structured to reach incomes at 40% area median income. And while it has not always targeted persons while it's always targeted persons who are either experiencing or at risk of homelessness, the targeting was strengthened in 2011 through AB 483 and now requires all units to be occupied that are built since this statute by formerly homeless, with 40% targeted to deeper subpopulations, including chronically homeless, homeless youth, and homeless people leaving institutions. So in looking forward, MHPSH could be strengthened by the use of coordinated entry to prioritize the most vulnerable, by the adoption of housing first practices in tenant selection and services, by increasing collaboration and access to health services, and by the local contribution of project-based vouchers to reach those with little or no income and to stabilize operations. The second program is the Federal Emergency Solutions Grant Program, which was retooled in 2011 pursuant to the HEARTH Act by the federal government, and after the expansion and lessons learned of the Federal Homeless Prevention and Rapid Rehousing Program. Again, ESG funds rapid rehousing, outreach and engagement, shelter operations, and prevention for all populations. After 2 years of HUD technical assistance and stakeholder engagement, HCD is just now completing its retool of the state ESG program for use with 2015 and 2016 funding. So the new state ESG enhances local flexibility while still driving toward strong crisis response systems, housing first, low barrier practices, focusing on key performance outcomes. Again, that homelessness is rare, brief, and one time. Moving from an administratively intensive competition, the new system will use a formula or uses a formula to assess need and distribute the majority of this federal funding non-competitively to all areas of the state with a continuum of care agency and with non-entitlement geography. Any additional funding provided by the state could be efficiently distributed for these activities using the same programmatic structure but removing the non-entitlement lens that the current ESG program has. And with that, I will turn it over to Todd. Be happy to answer any questions.
Good afternoon. I do have a short handout the sergeant can get to in a moment, or your consultant can get to.